I'm a research scientist working in public health at the CESTIM unit in Marseille, France. And my main topics of interest are community-based participatory research and harm reduction. To begin, what is community-based research? So this term is used in several contexts, and sometimes it leads to different ways of conducting research. However, there are many references and examples where it is clearly defined. For example, the book published by the INRS in 2012 explains the CBR's main principles, which are based on doing with people and not for people. It is a mobilization of concerned groups at all steps of the research process by creating an alliance with academic researchers. It is also a bottom-up approach from the emergence of the research question to the findings and their dissemination. It is also using and recognizing lay knowledge and living with expertise which complement the academic knowledge. And finally, it conducts to social transformation where the results are useful for advocacy. Another interesting book by Blumenthal et al. Provided some examples about the different community involvement in community-based research. Community-based organizations and groups can help the researcher to recruit participants, but they can do much more than that. They also can have a direct role in the design and the implementation of the research study. They also can be considered as peer researcher. And to fulfill this condition, I decided in my recent research projects to have a peer steering committee composed only with people from communities. And finally, they also can help spread the word about the study and promote its funding. Let's have a look on the main benefits of this approach, the community-based research for scientists and more generally for science. The first benefit of doing community-based research is to increase access to hard-to-reach or marginalized population. All the projects I presented in the previous slides focused on this population. MSM with high-risk practices who practice chemsex or were highly criminalized in some countries. Women who practice sex work in countries where it is also criminalized. Migrants with complicating living conditions, illegal situation, and difficulties of accessing prevention and care. And finally, people who use drugs, and more particularly those who inject drugs, a population which is highly criminalized in many, many countries. This population shares the same condition of illegality and stigmatization because of their unconventional behaviors. Another important benefit for us scientists is to have a more relevant research question. More specifically, we scientists and communities produce, yes, this question very important for the communities. For example, in an academic context where the research question would be, why do MSM not use condoms or not go for HIV testing? Community involvement encourages scientists to ask more detailed questions, such as, is there another way to protect oneself from HIV transmission? Or how do we adapt HIV testing to make it more attractive to MSM? Regarding people who use drugs, instead of simply asking why they do not stop using or how we could encourage abstinence, community-based associations encourage us to explore practical interventions that could be proposed to reduce related harms. Finally, in the African setting or in the context of migrants in France, we do not simply ask why migrants or female sex workers do not go to health services. Instead, we ask how we could empower them to improve their capacity to deal with structural barriers. Community-based research also imposes us to adapt methodology to field-related constraints. Having people from communities as peer researchers in a study can be an added value. In qualitative methods, for example, the photo voice method gives peer researchers the possibility to take pictures in order we can better understand their environment. Their insider role can also be very important in ethnographic studies. Finally, peer researchers can help also in ensuring that items and questionnaires we used are relevant in our quantitative surveys. Doing CBR also requires the use of innovative and adapted methods to reach target population. This is the case in the DRIVE project. It was based on respondent-driven sampling, which consists in a more sophisticated snowballing recruitment where the participants play a key role. Sometimes it is possible to use gold standard methods, such as in the Hypergate trial case, but sometimes it's not possible and we need to think outside the box to adapt our methods. One example is the AERLI project, where we used a specific method to limit the selection bias due to non-randomization. Community-based research provides also an interesting benefit when we have to popularize or disseminate our findings. More specifically, we scientists need to adapt and change our language during the research process in order for it to be understood by communities. And this in turn helps us to popularize our research to other publics. Then, community-based research provides a unique opportunity to share research practices. It gives us also the opportunity to translate scientific results for advocacy and to participate in creating impactful messages for public health decision makers based on our results. From a more individual perspective, and that is why I love the research I'm conducting, doing CBR is a way of sharing knowledge, which would not otherwise be possible, and also to meet engaged people by conducting research together at all steps of a project. It also improves communication as we need to adjust our language, as I mentioned previously. CBR involves different temporalities. The rhythm of the work performed is sometimes slower due to adaptation to community needs. And this is necessary and useful to ensure excellent research. In contrast, sometimes we also need to act swiftly, especially during health crises such as COVID-19 and more recently, monkeypox epidemics. Finally, doing community-based research leads to humility. Implementing it is also acknowledging that we scientists have not all the skills or a greater level of knowledge. Lay knowledge is equally as important as theory and concept. And as we all know, alone we go fast and together we go far. To conclude, it is important to remember that the fight against HIV has taught us how to improve the way of doing research. HIV communities and organizations have been essential to this improvement. As scientists, we will apply this new approach to other important public health and societal challenges. Research is characterized by many standards of quality to ensure good science, but community-based research teaches us that research is also about equity, ethics, and humanity. And finally, CBR is an important lever to bring about social changes from evidence-based findings. I would like to thank all the community involved in our project for continuing to share their time, their knowledge, and their services with us researchers. Thank you.